All right, we good, Megan?
Yeah, I think it just the little red line's going. So, yep, you're good.
All right. Hello, everybody. Welcome to our second installment of the Regional Report Out calls, an effort by the state of Kansas on a bipartisan effort by the state of Kansas to make sure you can know what's going on with the healthcare system in your region. Regions are divided by the Healthcare Coalition map under KDHE. This is the Northwest Regional call. Make sure we are on at 3:30 every Tuesday. Right here, you can sign up for an email where you get sent this call, a link to the YouTube of it, and the dashboard that we'll discuss. If you go to covid.ks.gov/report-outs, that's covid.ks.gov/report-outs. You can email us questions or comments that you would like to discuss on the next call at ksregionalreport@gmail.com, ksregionalreport@gmail.com. The format of the meeting today, we're going to change up just a little bit. I'm going to read through the dashboard for everybody and put it up on the screen. And then we'll get comments from our friends in public health, Jason, and then Shay from the hospital angle to provide some color and some life around those numbers. And then we have friends from Cheyenne Mountain Software who have the Mission Control app, which helps us understand what's going on with patient transfers. That'll provide a little color there. So grateful to have everybody here. Before I go in the dashboard, I just want to point something out. You can go to a website, gogettested.com/Kansas, gogettested.com/Kansas to find out where there's testing sites in your area if you want to get tested. And also then you'll hear, I'm sure, a little bit about vaccines and the positive energy that's created inside the healthcare system, but you won't hear a lot of details about vaccines in the public, mainly because we don't have those yet. Those will be on future calls. So just wanted to give you that heads up. All right, let's see. Megan, have you made me a host where I can share a screen? And I'll get up the dashboard. Okay, here we go. Sharing the screen. All right, hopefully everybody can see that. If you can nod, if you can see it, that'd be good. You see it? All right, perfect. All right, so this is dashboard that goes out with these calls. If you sign up on the email list, our friends at the Hospital Association, Kansas Hospital Association, put this together for us. They're wonderful to do that. We're very grateful. So in the Northwest region, there's 18 hospitals that report into this. And as we said on last week's call, issues with in the hospital world come down to staffing, stuff, or space. Staffing is the main issue that they're facing right now. So we're asking a question: who's anticipating staffing shortages in the week to come? You'll see 22%. That's probably the best average we've seen on the calls today so far. Still concerning though that one fifth of the hospitals expecting staffing shortages this week. You can see what's going on with COVID patients in the region, how many are in ICU, how many are in normal hospital beds. And then we come into adult staffed ICU beds and ventilator ability. Reason we say adult staffed ICU bed, an unstaffed ICU bed is just a bed. And so you got to have the people that are trained and know how to do the care. And so that is a number we look at also every week. So you'll see that there's, of the 24 total beds in the region, there's 13 available, which is 54%. And then ventilators, only 3 ventilators being used, 73. It's just nice that there's not anything there. And we like seeing the 0 on the reported deaths for the week. When you come down, you can see the number of new cases in the Northwest region. Obviously, very concerning surge there in November that started to come down as we rolled into December. This is the best looking graph of the regions that I've seen. And most of them have come to a plateau. So it would have stayed in that 9 to 1,000 range, which tells me that a lot of the efforts that are going on out there in Northwest Kansas are working. Theme of these calls has been just, what people are doing individually to work on this is helping their communities, clearly. We're all watching to see if there's a holiday bump after this, but this is a good news story for the Northwest region, I'd say. And Jason will be able to give us a little more color. Then you can see by county what the percent of population of that county that has tested positive. And then you can see a little more color on the ICU beds, what's available, what's being taken up by COVID and non-COVID. Obviously, there's plenty of non-COVID reasons that people need ICU beds. And so we kind of like to look at that breakout. So this thing gets updated. This is just a snapshot in time. I just want to point that out also. Where these hospitals are very dynamic movements and can look different, not only day to day, but hour to hour. But this gives us an idea week to week to get a sense of what's going on, in our region. So let me go ahead now and pitch it over to Jason, who can give us color from the public health side of what's going on regionally. Jason?
Sure. Jason Kennedy, Health Services Director for Ellis County. I appreciate you having us on, and good afternoon to everybody. So, what your graph showed is kind of what we felt here specifically in Ellis County, and reaching out to some of the other counties around us. We have seen a reduction in total number of cases, as we've seen somewhat of a consistent or a slight increase in testing as the state brought on some of the additional testing labs. So here in Ellis County, we actually, the additional testing capacity from Tour Health started on the 23rd, and that was our highest day really of this pandemic for our cases. We've seen a precipitous decline really from then, as far as the number of cases and as the percent of positive. So those are good news for at least the case counts. It does provide, at least on the public health side, a slight respite from the amount of work with contact tracing and investigation and all that. So as that workload's started to decrease some, obviously the workload regarding vaccines and the rollout of vaccines has significantly increased. So there are a couple of good things in that as we look at it, in that our cases are declining, and we finally have somewhat of an offensive tool with the vaccines actually hitting the ground. So as you said, we're really early in the vaccine process. Most of us at the public health level either received our vaccines today or will be receiving them tomorrow, or got them yesterday. So I think everybody's been working through plans, been working with really the healthcare community in their jurisdiction or their county to kind of figure out what that rollout is. Everything that we do right now is sort of pre-prescribed off of the tiered system that we get from the CDC and KDHE. So, I just encourage the public to continue the best public health measures that they've done, continue to do what they can to advocate for their own safety and for the safety of their loved ones. As we look towards bringing on more broad scale vaccinations. So it is limited at this time, but it is nice to know that we have an effective vaccine. It is on the ground in most of these counties, and should be rolling out, in the next couple of weeks.
Thank you very much. And I'll add just a little color so people can understand. On the vaccine rollouts, the way that it works is you get your first shot on Pfizer. 21 days later, you can get your second shot. And then it's 2 weeks after that you're considered vaccinated. Moderna, it's a 4-week or 28-day window between the two shots. So it's a 5 or 6 week process before, from the time you get your first shot to when you're considered immunized. And so not a time to let the foot off the pedal, so to speak. If we can remain vigilant here through January and into February, it'll be real important at helping create some of the capacity that you're seeing this week in some of these hospital numbers, and the capacity that Jason was talking about to be able to focus on rolling the vaccine out versus contact tracing, et cetera. So, Jason, anything you'd want to add on that?
No, I think, I know everybody wants the vaccine. They want to have availability of the vaccine, and we want that as well across really the whole healthcare community. And so there's kind of 3 different rollouts as far as we know. The hospitals have received the Pfizer vaccine. The health department and local level has received the Moderna vaccine pretty much universally. And then the long-term care facilities are going to be handled, at least in Ellis County and most counties, through sort of a third modality, or through a private contract with some pharmacies and things like that. So it is confusing. I understand that for the public, but we will. Everyone's communicating it as the best they can with the information they have, and we are advocating for getting the vaccines out as soon as possible.
Yeah, and it's a miracle that we got a vaccine in 9 months. Just a real true testament to the ingenuity there, and to be pushing out the rollout this quickly is really great. But obviously, this would be a place you can check in when we have information for your region. We'll roll it out to you through here so you can stay up to date on that. So thank you, Jason. Appreciate that. Now let me kick it over, Shay. If you can introduce yourself, what you do in Hays, and give us some color from the hospital side, that'd be great.
You bet. Thank you. And good afternoon, everybody. Shay Beach, Vice President of Regional Operations here at Hays Med, part of the University of Kansas Health System. Appreciate you having us on. I just want to echo, kind of what Jason had said. We received vaccines on Friday of last week, and there was a little glimmer of hope, I think, in everybody's eyes from the healthcare worker side of things. And that was something that we really needed and truly needed, was that little extra shot of encouragement and enthusiasm. So we gave shy of about 300 doses from Friday to Monday, and things seem to roll pretty well for us. We're excited. Obviously, that doesn't take into account every hospital healthcare worker that we have employed here, and we employ right at about 1,300. So we know that we've got a lot of vaccines yet to go still. I know, we're working collaboratively with KDHE, Public Health, Jason over on the Ellis County side of things, and to get the doses where they need to go and the vaccines where they need to go for the most appropriate. I know that that's pretty challenging, and we know that our clinics yesterday and today have had a lot of calls from patients. So just be patient, and we're going to get everybody through as most timely as we can. So echo a little bit, the numbers that are out there. I think yesterday we tested close to about 99 that came through Hays Med from a testing side of things. We had 27 total inpatients. Of those 27, 18 were active COVID positive, and 9 were recovering. And I think that's kind of the trick in all of this, is the recovery part of it. It just takes so much longer. And I think, we're pushing right at about 10 to 11 days from that recovery. And we've seen some, and that's on an average here much longer than that. So
And a normal, just for a frame of reference, a normal influenza patient might be 5 to 7 days. So it's
that's
almost
correct. Yep.
twice the time, right?
Yes, exactly. We had calls yesterday. Obviously, we're a tertiary care center out and service a lot of, critical access hospitals that might need the next level of care. We were on a call yesterday with probably 8 to 10 of them, and they're kind of seeing a lot of the same. They have a couple of COVID positives there within their local communities, talking about Colby, Norton, Smith Center, Phillipsburg, Pine Valley down in Larned. But, kind of everything seems to be a little more under control, which is a good sign. I think it's one of those things where we still need to be vigilant, and we need to still practice those pillars of infection control, and that six feet of distance and mask, when you're out in the community around one another, wash hands, all those pillars of infection control, because we don't know what next week brings, and the week after that. Everything is ever changing. So we just need to maintain that vigilance as we continue to battle this thing. Our ICU was open, and our MCU open to transfers today, so that's a good sign as well. Any questions that you have of me?
I know, Shay, that's great. And tease up the next part of it. And if you want to add anything after Dr. Watson goes too, that's great. So appreciate.
There is, one other thing. I think as Kansans, we've worked very well together across all of healthcare of Kansas. I see Dr. Watson up there, and Mission Control or Life Save, and Jason, County Health, and KDHE rolling the vaccine out, and everybody has really truly worked pretty well together in a time of a pandemic that really needed people to come together. I mean, we look at our critical access hospital network, and we've asked them to, keep some patients there that they would maybe want to transfer a little, sooner than possible. But that allows us to kind of, get ahead of the game as well. So everybody's really, that's what I'm probably most proud about.
Yeah, it's highlighted across these calls too. I mean, just the cooperation, desire to serve people. I think Dr. Watson mentioned at one point, it's humans serving humans when it comes down to it. And Kansans generally are pretty good at that. And so hopefully, you talk about the vaccine providing the energy, I've heard it called an injection of hope. And hope obviously is important. If you're a fan of Shawshank Redemption, which is one of my favorite movies, you can remember how important hope is. And hopefully coming into a new year, we can reminded that if we can stay vigilant, we can really beat the virus. We have an offensive tool now, as Jason mentioned, to go at this thing. So we'll be watching these numbers. Important that your ICU and MCU are open. And can service as it funnels. Now, the way the hospital systems work, this is for the people watching, obviously, Shay and Jason know this, but the critical access, in the rural generally, as things get more severe and acute, moves into the regional hubs like Hayes. Then as it gets more severe, it moves into, just where there's more expertise, more tools available, into the major metro hospitals like Wichita and Kansas City. And so that transfer of patients up as they need more care, and then also the transfer back down as they need less care but want to be closer to home, is really what this mission control app's all about. And the way it's set up and in its modern structure, it also produces a lot of data. And so I'm going to let Dr. Watson, who is one of the founders of this and has practiced medicine in Kansas for a long time, and his partner and colleague, Jesse, just to walk through their tool and what it can show us. It's really one of the first places we really believe that you can see if there are cracks that start to form inside the healthcare system, that this data around transfers and how long it takes to transfer is one of those places that we can see. So we want to watch these steps, but thought it'd be great if he could walk us through what he's seeing and help explain it to us. So Dr. Watson, go ahead.
Great, thanks. And I know you use the Shawshank Redemption, but that guy had to swim through the sewer to escape, if I remember right.
That's the way it's felt for a lot of people, I think.
Yeah, some days, I don't know, that's probably close. This is a kind of a graphic we use. It's state numbers, but we put it in a format that we like. The blue is positive cases, the red are hospitalizations, the black is our deaths. But I think it says, speaks to the fact that we're at a level we haven't seen at all during this pandemic, and it's holding pretty steady. I know you can make a lot out of the undulations and whether we're recovering or getting better, or whether there's a spike at Thanksgiving, but I think ultimately we're all maintaining at a fairly high level of disease right now, and we're going into two big traditionally get together holidays. We just need to remember we're not near at a place where we can afford to let the guard down. But the next is the way we track availability of beds. It's different than probably a lot of other systems track that. We're using three buckets: normal capacity, at critical capacity, no capacity. And a lot of times we get near capacity, and hospitals can take patients on a case-by-case basis. There's a lot of times we can make room for people if it's the right person and the right fit. And it does change every hour on the hour, I mean, this is one of those things that it's a very fluid and dynamic picture. We measure it twice a day, only to give the communicators a guiding light to be able to know where to call first, where would have a potential opening quickly. Sometimes we're having to call 5, 10, 15 facilities to find bed availability, sometimes 2, 3, 4 states. We're getting calls from Texas, Oklahoma, Missouri. We're working with Nebraska actively to coordinate with some of their efforts as well. We traditionally have receiving hospitals, but we've also expanded that list to some non-traditional receiving hospitals to help us access as many of the resources in the state of Kansas as we can. and are working with senders and receivers to try to make that network more solid, be able to move the patients up and down to take advantage of that. The next graph is a graph that we pull off the live dashboard every 2 hours. And it gives us real-time access to patients' movements in the state. And in the future, we'll divide this out by region, but just to get a flavor for what kind of data is out there and what we can learn from it. And Jesse, if you'd walk us through that, that would be great.
Yeah, my pleasure. So this is a snapshot looking at the last 30 days within the state at the transfers. You'll see in the top left some interesting metrics. 38% were transferred under COVID presumed precautions, meaning that that patient either was likely to have COVID or had been exposed to COVID and needed to protect all parties involved in that transfer. And 35% had requested assistance in locating and accepting facility. Obviously, that's very abnormal within what we see historically within the state, where most facilities, their established transfer patterns are pretty well defined, and that flow of patients occurs easily. So this 35% speaks to the saturation in those primary receiving facilities across the state. You'll see the trend in terms of COVID, true, false. And here we've got these two pie charts. We can look at time critical diagnosis and transfers needing bed assistance. And then we can evaluate the impact on the time metrics. So this median request to arrive time metric is the time from when the record hits the database for request for a transfer to when a crew is marked as arriving at a facility. So see an hour 18, but if you toggle those to look at the those that needed bed assistance, you'll see a significant jump, over an hour and 15 minutes in time added to that duration. Furthermore, if you tack onto that COVID, that time, again, very significant. And we see that just the impact overall on the system is considerable. And the COVID no's have a bigger jump. So COVID false, needing bed assistance, 21% of those transfers, and that median request time jumped almost to 3 hours. This again, just speaking to the time that a lot of those critical access hospitals are needing to chase down where a potential receiver can be, and you know, the receivers are doing a fantastic job. I mean, it's obviously not due to effort. It's just a high volume of patients needing care and needing specialized care not available in those critical access hospitals.
And just as a frame of reference, that time would normally be an hour or less in a non-pandemic, non-COVID timeframe, right?
Yeah, for a rural facility, around an hour, and for those that are a little closer in, obviously significantly less. And you know, for time critical diagnosis as well, those heart attacks, strokes, sepsis, those sort of things, we keep that as low as possible. So mission control attempting and working very diligently to be an extension of each one of these facilities teams, so their caregivers can stay focused on the patients and we can do the legwork on their behalf. Obviously, anytime a facility has a specific place they want to go, we do everything that we can to make that a reality, but we can't create beds at facilities. So our attempt here is to continue to offload the work from those teams so that we can let those caregivers focus on the patients.
Yeah, really to note that while this is primarily, we focus on COVID and the impact that has on the system, that there's still the usual heart attack, stroke, sepsis, all the normal things we see every day, and they're still being affected by the problems we have in the system. So the fact that you have somebody, and I think there's a Satanta one that's all too common, where you have somebody who's waiting, you know, close to 6 hours in time frame for bed placement for a GI bleed, and you think, you know, you're in a facility that doesn't have all the resources that a referral center might have, waiting to get this patient moved upstream, knowing what has to happen here. We have story after story where, you know, they're treating very significantly ill people, and we're offering consultation services, we're offering help in the management of it, but the system is at a point we've not ever seen it before. And really important that we understand, while there is a little bit of a break, it seems, we really need to stay the course here. We're much more fragile than we realize, and at any moment it takes a pretty ugly turn. So everybody, as has been said, needs to stay vigilant, stay on course here.
Yeah, Dr. Watson, I'll point out last week on this call, the CEO of Hayes Regional pointed out that they had to turn down over 160 transfers into their facility. He was estimating somewhere around 75% from within the region, and this is the kind of data that relates to that, where critical access hospital can't get it into that regional, so the person has to wait longer to find a bed and go further away to get there, and generally you're in worse shape by the time you get to where you need to go because you've had to wait for that time frame. So this kind of
Very
brings that to
difficult
life.
conversations with family members. Have an elderly family member who has COVID, and the idea of moving them across state lines without family to a hospital that no one is familiar with and with resources no one really has context for. It's unprecedented, and certainly a lot of very difficult stories here. 24/7, holiday, no holiday, weekend, no weekend. These are families that are dealing with a real crisis.
Any facilities in the region that would like to learn more or have a demo, have any questions? Obviously, we want to work really closely with any facility, local EMS, any transport agency. Contact at CheyenneMountainSoftware.com. We'll get you in touch with the right people and would be happy to answer questions, do additional facility demos or whatever would be helpful to the region.
Yep. Thank you, guys. And what this is doing is giving people more time to focus on patients versus trying to find places for those patients to go. But this is data. They'll be helping us look at this regionally to have an understanding of what's going on. As I said, as we were introing this, understanding when the transfer issues start to clog up. That's when the healthcare system clogs up, and you're not able to advance people to the stations where they can get more specialized care that they need. Let me throw out there to any of our other panelists here, Shay or Jason, is there anything you'd want to add to that presentation before I wrap it up?
I just think that it was pretty timely to have that available, and somebody recognized that, a few months ago, and hats off to them for helping, because it was a struggle. We heard from many hospitals being on the line for 6, 7, 8 different places that they were trying to call where they need to be focused on the patient. So
Yep.
Thank you. Well, Jason, Shay, thanks for being on the front line and doing what you guys do in your communities. Thanks for giving, I know you're both very busy, giving up time and energy, especially this week, to be on this call. We wish everybody out there happy holidays. Now, generally, I like to end with a bright spot. This is the only region I didn't get a bright spot from this week. So if you catch someone doing something right, please send it in to ksregionalreport@gmail.com. I will share my favorite bright spot from the state. We like to catch people doing stuff right. And this is the Humboldt Police Department. Generally does a Toys for Tot drive. They decided to do an Adopt a Grandparent drive, as they found 73 grandparents and elderly in their population didn't have family close, and had people from 4 other states besides Kansas agree to adopt different grandparents. And they showed pictures of presents, and they baked cookies and all this stuff to give to those folks to know that they care. So just people stepping in, inviting others into an act of kindness to make a difference. It creates some light and beauty in an otherwise confused and darker time. So some good news just on the numbers here in this region. Good work to everybody. And again, important to stay vigilant as we start to see a light at the end of the tunnel. So thank you, everybody, for what you're doing. We wish you a happy holidays. We'll be back at the same time next week, 3:30 for the Northwest Regional Call. Have a great holiday, everybody. Thank you very much.
thank you.